So I would like to begin this evening's program, The Mind and MS, Cognition, Changes, and Coping, and start with a big thank you to Lynsey Lakin, for nurse practitioner with great expertise in MS, working with MS in California, who is joining us from southern sunny California tonight to share her wisdom and knowledge and also give us a chance to share. So Lynsey's going to attempt best she can, trying to cram all her information into us tonight in about 30 minutes. So we'll have time to share and also have time to ask questions. So bear with us, and thank you and welcome to Lynsey.
Thank you, Michelle. All right, I think you guys can all hear me now. But yeah, likewise, I think it's so incredible that we can at least have this virtual platform to meet from 2 different states and just kind of join both nonprofit groups for this empowerment learning experience. So welcome. It's great to see so many people on for the talk, because I think it's so important. Cognition and MS is something I'm very passionate about. And currently I'm working on my doctorate degree, and the focus of my topic is actually on cognition. So as Michelle mentioned, there's so much information and ongoing, which is very encouraging. So there's a lot of research in this area, both in what causes the cognitive problems. And when I say cognition, I mean memory. So what causes the memory problems and what can be done to help it, because that's an area right now with treatments, and I'm going to discuss a little bit more in depth, but that's an area that's a little bit lacking as far as medications or therapeutic avenues to manage the memory problems in MS. So that's what I'm going to focus the talk tonight, and we're going to learn from each other too, which is wonderful. Okay, so I have kind of a thoughtful initial slide here. So it's to ask yourself, what has been your experience with the memory problems? So obviously there's probably a reason you're on tonight. Maybe it's just to learn about the topic. Maybe it's something you're struggling with yourself and you want to learn different ways that you can maybe improve upon a specific aspect of your memory, or you're noticing some changes and you want to learn what can be done to keep it from getting worse. Some of the, prompting questions I have here is, are you having trouble recalling the right word to say? So this might be, oh, what's that thing? And you know that it's a water bottle, or it's a purse or a computer, but you're having trouble recalling that word from your brain to actually say it. Eventually it comes, but it's a little bit of a struggle. Part of that is slow processing speed, which is kind of the next point. So maybe you're not able to process information as quickly as you once were able to. It can make it very difficult to work. I personally have a lot of patients that I treat with MS that have unfortunately had to stop working because they just can't stay on top of the tasks or process the information quickly or remember what to do. They're forgetting things and lacking, and so therefore they have to discontinue working and go on disability. Also, I think something that doesn't get highlighted as much as the occupation problem, but it could be how it's affecting your home life. And it could be very frustrating for yourself and also for family members if that repetition is always having to happen, or you're forgetting important dates, things like that. And I have a couple things I think in the chat, and it might be some feedback, so I'm going to open it. Oh, just a thank you. Good. I'm glad that
and
it's going to be a helpful
yes to all your questions.
Yes. Right. I think those are very common things, and something, all those different areas of, I guess, living is what you would call it. So all those different avenues, there's typically and commonly there's struggles because of the cognitive impairment. This is just some information from a representative sample of 291 adult patients from a study that have different types of MS. So if you can recall, there's relapsing remitting, which is about 95% of the population from diagnosis. And then there's a secondary progressive MS, tends to occur when you've lived with MS for a number of years. And then primary progressive, which is much more rare. So with all those different types of MS, they were included. But these are the different percentages in terms of what people were experiencing problems in with the cognition. So processing speed was about 30 to 50%. So one of the more common areas of problematic cognitive functioning. Visual memory, so this is looking at something and remembering it that way. That's about 54 to 56%. The verbal memory, so like visual, you learn something by seeing it. This is learning or remembering something because you've heard it. That's about 29 to 34%. That would be like storytelling, things like that. Visual learning, I think about my patients that say they can't read anymore because it's hard to keep up on this story if you don't remember what the first paragraph or the previous paragraph said. And then executive function is about 15 to nearly 30%. This is like following instructions. So if you were following a recipe, for example, that was very complex, and you had to remember what you did previously to remember what you have to do next and what the end goal is. So that's executive functioning, following directions. And then visual spatial processing is about 22%. So this might be remembering directions, how to get somewhere, maybe get lost, or some kind of confusion about what space you're in. So those are, although we say memory problems, you can see that when you break it down, there's actually different parts about memory function. And I think it's important to break it down and really figure out which area is problematic so that when it comes to therapeutic avenues, you know, you're not doing something, you know, you're not working on visual memory when really the problem is processing speed or something like that. So this can be figured out with memory testing, and we'll talk about that in a later slide. Rarely impaired, so we think about things that typically don't happen with MS-related memory problems. It's basic language, semantic memory, so that's, you know, remembering your colors or remembering how to get dressed. I think the things that tend to happen for Alzheimer's disease, people with MS do not experience, fortunately. And then attention span, which actually caught me by surprise because the vast majority of patients that when I'm talking about cognition, they say they can't focus on a task, but maybe that's executive function. So that's about 10% of people, you know, may experience one of those. Oops, here we go. Okay. So looking at cognition impairment in the subtypes of MS, so this is broken down into what you may hear of benign MS or something that doesn't really take a full course, frequent relapses, and now the hospital to get steroids, etc. So this would be somebody with clinically isolated syndrome or radiographically isolated syndrome. So just happen to find an MS lesion on an MRI when you went in to see your doctor because you had headaches or you hit your head on something. So actually about 20 to 25% of those people experience memory problems. So you could see that although somebody is fully functioning with walking, they haven't had a lot of relapses, they have their vision intact, etc., they can actually experience some cognitive problems that could be substantial and imperative on life, daily life. Also, worsening with MS relapses, it may be that you don't have optic neuritis or lose your vision acutely or develop some weakness or numbness with an attack. And an MS attack is something brand new, so brand new symptom that lasts 24 hours or longer. Maybe it's not physical, but you can actually have a cognitive relapse. So this might feel like you're in a fog, brain fog, you can't think clearly, having much more trouble staying focused. Things like that are some of the verbiage I've heard. And it's actually been presented in some studies with cognitive function tests, namely the symbol digit modality test. We can see a 4-point worsening in their score during a relapse, so pretty substantial. Relapsing, remitting, we see about 30 to 45% of those individuals having cognitive impairment. Secondary progressive, you can see that the percentage jumps. And my personal opinion on it is that maybe there's some data to back this up as well, but usually secondary progressive piggybacks from relapsing remitting phase after about 10 years of having the diagnosis of MS. So there's a lot more lesion accumulation, typically a lot more gray matter involvement, brain atrophy, which is we see overall shrinkage of the brain size. So by the time individuals get to that stage, we tend to see a little more frequent cognitive impairment. And then with the primary progressive group, unfortunately, because it is a more rare subtype of MS, there's a lot of really small sample sizes and you can get variability. So it's hard to name a certain percentage for those individuals. And that's those are people without relapses from the start. They're usually diagnosed later in life. And because of the gradual onset of disability. Kind of interesting statistics there. Another thing to think about is other comorbid symptoms or psychological impact on cognition. So if you struggle with a lot of fatigue, that oftentimes coincides with cognitive impairment. And I've actually had a situation where I've done a cognitive screening test, so memory testing on the same individual in the morning, and then, or I'm sorry, it was in the evening first, but she was extremely fatigued. And I said, you know what, come back in the morning, let's redo this. And she did it in the morning and it was much better. So, and I think we all feel that to some extent. If you're not getting a good night's sleep, which is the second point, and you have more fatigue, you're just not going to think as clearly. So sometimes treating the fatigue, getting more sleep can actually help improve the cognition. Also comorbid depression and anxiety disorders. So untreated depression, we oftentimes see a little bit more poorly functioning memory with that. And then other psychiatric disorders, which actually is common with MS. If I remember my percentages right, it's about maybe 35%, 20 to 35% experience some kind of psychiatric disorder. Depression is kind of thrown in there, but bipolar, schizophrenia, or pseudobulbar affect, I didn't throw that in there, but that can happen as well. But with that and MS, the tendency to have memory problems is a little bit higher. And then medication side effects, if you're taking something that causes drowsiness, or topiramate or gabapentin for nerve pain, those can oftentimes cause a little bit of slowing with the cognition. Okay, so the big question, what contributes to cognitive disability? And this slide's mainly focusing on brain lesions. So there's been some data from MRI studies showing that people with more cognitive impairment seems to be correlated with cortical lesions, which are tend to be on the outside here. So this is juxtacortical lesions, which are touching the cortex, so the outer portion of the brain. And then gray matter volume, which we usually don't see on our traditional MRIs because it's mainly highlighting the white matter, but we do have gray matter, which is deeper within the brain tissue. And then changes in the thalamus. So you can actually get lesions here in the brainstem, the cerebellum. So all of these really important structures deep in the brain. And the function, when we think about the function of the thalamus, the hippocampus, the amygdala, all of this work together, and even the cortex, which is the outer portion of the brain. It's basically a communication feedback loop where we're gaining input from our eyes, our senses, that filters through our cortex, sends the signals to the middle part of our brain, and actually the amygdala flags different sensations or memories or taste or sight and says, wow, that's really beautiful, I want to see that again. Or, oh, this tastes good, I want to eat this again. Or, oh, that really hurt, I don't really want to talk to that person ever again. That's a bad memory. So it flags things as good, bad, let's do it again, I want to remember this, all of those things, and works with the thalamus and the hippocampus to store those memories. So it actually makes sense that if any portion of the brain within the cortex, the thalamus, the hippocampus, if all of that isn't functioning well, we're not going to be able to store those memories appropriately or adequately. And if we have lesions, which I usually use the term that it's causing traffic jams in the communication between one motor neuron to the next, then we're going to have the slowing of transition of communication from to each of the neurons to create that processing speed more smooth. So that's the best way that we understand as far as how brain lesions can contribute to cognitive disability. What's interesting though is sometimes we've seen where, because I'm looking at MRIs a lot, I can see a young individual with a lot of brain lesions and they're very much intact cognitively. They're working, they're taking care of kids, they're managing finances, etc., not having a lot of problems. The idea of neuroreserve, which is basically it's like the brain is able to compensate for the disability that is accumulating. And we have more neuroreserve when we're younger, when we're healthy, when we're getting enough rest, eating right, drinking plenty of fluids. So all of the basics helps to build that reserve up. And when that reserve is high, we're able to compensate and not really experience that cognitive impairment. Once the reserve sources are exhausted, however, then we have diminished connectivity, and then we start to see more of the cognitive impairment impacting daily function. We talked about how relapses can affect cognitive function more in the acute phase. So it's not like you have a relapse and then your cognitive functioning is impaired for a prolonged period of time. It may, but not traditionally. Usually it's during the duration of the acute inflammation, and then it starts to resolve back to baseline. So we do see that. And then progression of gray matter volume loss. So that overall brain atrophy is the terminology. So we can compare brain size over time. And if the brain size shrinks at a faster rate than normal aging rate, unfortunately, all our brains shrink with age. So the more we can learn and exercise and take care of our brains, the slower it will shrink. If you have MS, it's almost double the rate. So there's ways to slow down that progress and build that neuro reserve, and that ultimately will preserve cognitive disability or reserve cognitive function. So I mentioned a little bit earlier about assessing cognitive function in the clinic, and unfortunately, it's not done as frequently as it should be. Many times, the reality is that clinics are busy. You're allowed a certain length of time with your clinician, and there's so many things to cover in that short visit time. And so oftentimes the cognitive screening, it takes a little bit longer to do that. So it might take up the whole visit time, and we can't talk about some of the other important things. So I think because of those barriers, it's just not done as routinely as it should. But it is important. It's important, of course, to recognize cognition as being part of your disabling disease, because, as we talked about, it can result in losing a job, having relationship issues, and it being frustrating. And so talking about it, recognizing that it is a problem, and gaining some therapeutic recommendations, and also maybe it's significant. It's significant in that maybe you're having a relapse. So then it's important that it's recognized as well. So communicating that you're feeling extra mentally foggy can help us to maybe kind of feel or understand that the possibility of you having a relapse is likely. Also, I think it's important too, if you do in fact become disabled because of the cognitive impairment, you would need that evaluation on file as well to help with that case. In seeing a neuropsychologist, this would require referral if you're seeing your neurologist or MS specialist, but they do real in-depth testing. One visit can take 5 hours. And it's just all mental testing to figure out what areas of cognitive function is debilitated because of the MS. I do like the SDMT though. So that's this symbol digit modality test right here. I like it because it takes 90 seconds on an iPad and 2 minutes on paper. So not a lot of time. And it's actually one of the most sensitive cognitive screening tests for picking up cognitive impairment out of all of them. So, and that's for screening. So I like it for that reason. It's very sensitive in detecting the issue, and it doesn't take a lot of time out of the allowed clinic time. Okay, so we talked about some of these things. Just want to make sure. Yeah. So this is an image of the symbol digit modality test. If you've taken it before, this would look familiar. Basically, and I think it's kind of interesting to think about how this test works, because then you can think about, oh, that is something that's really hard for me to do and process. If you do, in fact, have trouble with processing speed. But essentially in this first row, you can see that there's different symbols. They don't make sense at all. They're just images and symbols. And then underneath that are numbers that are associated with that symbol. And the goal of the test is, there's multiple lines of the symbol in a blank space. And you just keep going until the time's up. And you're graded based on how many you were able to do. So, here I would put 9, here I would put 3, here I would put 4, and so on. And you're graded how many how many numbers you were able to fill in each box and how accurate were you. So if you miss some, that would result in the effects of your score. So that's how that test works. And it's thinking about that symbol, going back, processing what's the number to put there, and then logging that number in the correct box. So, so the symbol digit modality test is one very simple way that can be done in the clinic. Okay, so this is just another reflective slide. Do you feel your cognitive function concerns are being addressed? Is it difficult to bring up your cognitive concerns to your treating neurologist? Sometimes it is hard to do that, especially, you know, I think if you've worked in a very mentally demanding career and it was how you define, you know, what kind of identified yourself or set you apart from others, then it can be almost a hit to your identity or what you took pride in, or what you felt like part of your purpose was for living. And so it can be very difficult. I don't want to know that my memory is going, is often kind of the feedback I get from people that are struggling. And then, you know, have you had an evaluation with a neuropsychologist? I think it's always a good idea to have that evaluation. Doesn't have to be a routine, but at least once if it's an area that you really struggle in. Okay, this is good. I see that we have some input in the chat. I think that'd be great if you guys want to input some thought in the chat, and then we can add that to the conversation after. So some of the therapeutic recommendations I mentioned earlier that this is really where the lack is on treatment methods for cognitive impairment. And currently there's no FDA approved pharmacologic treatment options to improve cognitive function. So that means there's no medication that has been FDA approved to treat it. We have medications that are used off label, like medication for attention deficit disorder, which can also help with fatigue. The dementia medications don't work at all. So it's really difficult to treat with meds. Research suggests that cognitive training involving some restorative approaches is beneficial. So that's with a lot of repetition. So oftentimes in most of the studies with different types of cognitive therapy, so that's either with therapy with storytelling, you hear a story, repeat it back. You're doing some kind of computerized tasks, which I think is becoming more and more common, or other type of therapeutic avenue with an occupational therapist maybe. It has to be repeated because once the therapy stops, research shows that usually the cognitive impairment starts to come back once you've stopped for some time. So it is something that has to diligently be repeated on a regular basis. And that's keeping the mind active. This RACOM, no, I'm not familiar with it because I'm more of a hands-on person, but this is apparently one of the most studied programs for people with MS, and it's a computerized based cognitive rehabilitation. And it helps to improve attention, cognitive processing speed, memory, and executive function, which are those areas that, other than attention, was about that 10% area of prevalence, but the others, you know, we know now those are the areas that tend to struggle in if you have MS. So exercise has also really been studied and shown to help improve cognitive function. Again, kind of in that acute phase, meaning it's not like you walk for a few days and now your memory's going to be fine even after you stop walking. It's something you have to keep at. So It's still under a lot of research. There's so much going into this. A lot of real small studies that look positive, and I think we're going to know more and more with time. It seems like one of the common themes is brain activation, and connectivity is important. So anything that can activate the brain, I think just even socializing, you guys being here tonight, you're learning about your condition. We're going to have time for interaction. That's keeping your mind active and connecting the dots. Also, we want to improve cognitive reserve. We talked about how when that reserve starts to lower, that's when we start to have problems. So ways you can do that is physical exercise. It's eating right. If you can't physically exercise, we can eat healthy. We can keep our mind active. If you have trouble with reading and retaining a story, that's something you can work on as well. Just read one page or a short story and try and remember that story later so that you can tell your spouse what that story was about or what that page was about. That's how you start to rebuild that reserve or maintain what you have, is by practicing those things that are difficult. Also, disease modified therapy. This is what I mean by that are MS medications. What they do is preserve brain tissue. And so if we can cut back on how much white matter demyelination we're accumulating and preserve, a lot of them also preserve brain atrophy. So we're keeping the brain size, preserving white matter on neurons, and also now part of we call it NEDA criteria, which is no evidence of disease activity is what that stands for. It includes reduction of brain atrophy. So, and the reason for that is the recognition that cognitive impairment is a big problem. So a lot of the therapies do prove to reduce that process. So that's part of it. And then lifestyle modifications like we talked about, or like I discussed. And ultimately, I think if the more combination of all of this, probably the better. So combination of cognitive rehab, cognitive behavior therapy, this is positive thinking. Again, if you struggle with depression or anxiety, that is something that has to be addressed in order to improve the cognition. Transcranial direct current stimulation is under study. I don't know too much about it other than that there's some kind of stimulation from the outside into the brain to activate the neurons. And then aerobic exercise, if you have the capacity to do that. So that's anything, walking, if there's a floor cycle, or a recumbent bike, as Michelle's a big advocate of that. Anything that you can physically do to keep the blood pumping and keep those endorphins up, and ultimately stay healthy, prevent cardiovascular disease and obesity, is going to be good on the mind. And as I mentioned, further research is needed, and it is happening, which is good. Okay, COVID has been a big setback in so many ways. And interesting to note that it has had a big impact on cognition too. And, why is that? I think the consensus, I've had this discussion with some of my other MS specialist peers, and I mean, there's a reduction in socializing, which there's a downward stream of depression and just feeling anxious and not supported. And so that is going to lead to reduction in cognition too. And it's just not that mental stimulation that comes with socializing. Reduction in physical exercise because we can't go to gyms to have access to machines if that's what you need to help balance. For a while we were afraid to even go outside of our house. possibly if you live in a close, crowded neighborhood. And then, you know, I'm sure there's other factors too that have weighed into your experience with that. If you've experienced loss of a family member, or if there's just stress in general, that certainly will affect the way that you're able to mentally process information. And these are just some references I included, really, really good, thorough articles about cognitive impairment and different management strategies that are currently have been done, and where we're going with that. So if you love to read more about that, and I believe we're going to have some opportunity for sharing too. So I'll hand the floor
Yes.
back to you, Michelle.
Great.
Oh, I got it.
So thank you. Thank you so much. And so we're going to go back to, thank you, Lynsey, for just a fantastic presentation with so much good information, and put in a way that honestly, I think we could all take some concrete ideas and have a better understanding of the pathological component of MS and cognition, which really helps us kind of better understand what we're dealing with. So what I'd like to do at this point is just, if one by one as I call on you, if you would unmute your microphone, and if you'd like to share what you indicated when you sent your email in, that you'd like to share a little something, if you'll just do that. So I'm going to call on Mary first. Mary, would you like to just share something that you mentioned that seemed to be helpful?
Sure. I've got a lot of cognitive issues going on, and I've noticed that I do my worst at it when stress is involved. But with things that I've noticed that help, and this was recently, I've had MS for over 20 years now, and I correlated making meals for my family as stressful, because the cognitive issues, and it just was stress. So I just stopped doing it. And I decided I didn't want to do that anymore, and I wanted to get back in the kitchen. And I have found that if I go through the day and I get the meal prepared, just prepping everything ahead of time, then I can go about my day. And then when I come back in the evening, when I know my husband's getting ready to come home, I feel no stress. And when I don't feel that stress, I can think more clearly, and it's not as big of an issue.
Thank you very much for sharing that. I really appreciate it. I think that's a good practical example. Okay, now I'm going to ask Jerry. Jerry, would you kindly share? I'm going to ask you to unmute. And
okay, I did.
see. All right, there you go. And I'm going to go ahead and just, if you'll share what your suggestions were and what works for you.
Well, first of all, I have a question for Lynsey about brain atrophy. I mean, is there a way that we could stimulate, we should stimulate our brains to hopefully, if we don't use it, you lose it, is what I've always been told. So are there any suggestions as to how you could stimulate your brain? Is it by playing games, that type of thing?
Yeah, I think that's a lot of what's being looked at in the research. And what's interesting is out of everything I've read, most of the time it's going to work if it involves physical movement, if it involves having to think about, you have some kind of input come in, whether that's you're talking with a friend and they have some information. Your brain is hearing that, it's sending it to the cortex, sending it into the brain, into the memory. And how you want to challenge yourself later is maybe later on in the day or the next day, try to recall what that story was that your friend told you. And, you know, but that's how we exercise our minds. It causes some self-reflection to think, what do I have? What do I struggle with the most? You know, is it remembering names? Is it cooking? Is it, you know, anything like that? And, you know, when you have the time to do that, I think I'm so glad you mentioned that, as far as taking yourself out of that stress, because your brain just isn't going to work under stress no matter what. But if you can be in a calm environment and try to recall the information or cook a meal or play a game, you know, playing a game, it's hard to be stressed and play a game, you know, unless you're losing, I guess, but you're still having fun, you know, if it can be lighthearted and you're laughing with somebody, the brain just thrives off of that. So I think those are good ways to, in the very least, maintain what you have. But you're right. If you don't use it, you go, oh, I can't, I struggle with reading, so I'm not going to read. You know, I struggle with remembering stories, so I'm just not going to bother. I'm going to write everything down and just rely on that. You got to work at it too.
Thank you.
So Jerry, do you have anything? Thank you. Do you have anything else you wanted to add? All right.
I think being social, trying to be social, and right now it's through a lot of texts, but just to keep the lines of communication open. So when we could socialize more, we still have it. That's all.
That's wonderful. I agree with you totally. All right. So next I would like to hear from Elaine Cole. So
Michelle,
Elaine,
you see that we can't see you. I just want to ask real quick. Do you know that we just see your picture?
no, you should all be in gallery. Does everybody see gallery?
Yeah, but just with your, we can't see your face though. It's just your picture.
Your video's off.
Oh, you're right. Okay, I'm sorry. Let me start my video.
Sound like you'd be doing that, so I wanted to say something.
Thank you.
Yep.
All right. Thank you for saying. Okay. Elaine, did you want to share?
Well, yes, since you asked me to. I have had cognitive issues, and I'm not a visual kind of learner, so that I would do terrible on that SDM whatever symbol test because I just can't do it. But my comment that I wrote to you was about all the calendars I keep. I keep one of those little wallet-sized calendars in my purse, so that if I'm out and something, you know, I have to make like a doctor's appointment or something, I can write it in there. And then I come home and I have a day planner in here in the computer room that I will transfer everything to. And then I also have a calendar as I walk out my door that's got my family birthdays and that kind of stuff on. But if it's something really important that I need to know about, I will see it when I walk out the back door to get into the car. So important stuff I add to that calendar. I used, when I was in college, I majored in mass communications and I was a journalist. And I was very fortunate because I could remember what people said word for about 3 or 4 weeks. So I didn't have to take detailed notes. But I can't do that anymore. I can't remember what people say like I used to be able to do. And I left my second profession after the journalism. I was a teacher for years. I was diagnosed when I was in my 50s. So I was old to be diagnosed. I mean, the first neurologist said, oh, well, you know, if you were younger, I'd say you have MS, but because you're so old, you don't, which he didn't know what he was talking about because my symptoms never went away. See, I do remember that kind of stuff. But I find myself, I can't remember what I tell people. And sometimes I can't remember what they tell me. I text, I try to socialize. I'm on the phone a lot and I'm texting my daughters all the time. So, but I mainly think if I want to remember something for certain, I have to write it down. I have to make a list. I use the list thing in my phone, and There are a lot of other like Alexa things that can remind you of your appointments. I use my calendar in my phone because it reminds me a half hour before I have to be somewhere. So those are the kind of aids that I use to try to keep up to date. That's all.
Thank you, Elaine. I think you're exactly right. So much of what you said, the calendars, I like to, when you're walking out the door, it's the very vital information and it's the note taking. Those were, I think, the three key components that I heard. Now there's one more person I'd like to call on, and then I'd like to open it up for general questions. The last person I'd like to call on to share would be Carol Shambliss. If you would like to share, I would like to hear from you.
I just have to unmute. That's
Yes, okay,
it. You can hear me?
you're on, Carol. Perfect. Yep,
Okay.
go ahead, Carol.
Oh, yeah, my biggest thing is, well, I've never been able to remember names. I'm terrible with names, but that's something I've always had. I was diagnosed with MS at 48. I've had it for 30 years. I feel like my mind is still pretty good. It's just, I can't, these words just don't come out when I want to say them. I want to say something and it's not there. And it's, I'm always looking for a word that I've lost. That's my biggest
Right.
problem.
So I think that's a common situation, but I think what you pointed out was that, you know, you recognize some of the things that are happening within you and find a way of working around them. So I appreciate you sharing that. Thank you. So
Okay.
at this point, I'd like to just go ahead. Everybody is welcome to switch to gallery view. I'm going to allow just open questions. If you would please raise your hand, or
Switch to
that would
gallery.
probably be easiest, or if you type in the chat that you'd like to speak, that would be great. Then I know to call on you and it won't be a free for all. So if that works, just go ahead and raise your hand or type in the chat. That would be great. I don't see any. There we go. Okay, Shelley, go ahead and ask your question, please.
Okay, so I'd like to know how you can tell the difference between the natural aging process and cognitive impairment because of MS.
Great.
I mean, how do you know the difference?
All right, there we go. All right, let's address that question. Lynsey?
Yeah, so Shelley, I knew someone would ask that question because I think it's a great one and can be difficult. I think a neuropsychologist, in the sense where, you know, if you came to me and you're asking me as a patient, you know, is this because I'm getting older, or is this because of my MS? You know, I might have the referral go through for seeing a neuropsychologist because they're able to do that in-depth cognitive testing where they're looking at multiple areas of cognitive function.
So would there be something like a baseline that you would want to start with? So let's say
Yes.
at 58 or whatever that is, and then you can see over time if there's been
Yep.
changes because of that.
Yeah, I think that it's good, and I do that in my own practice. I have you know, people do the symbol digit modality test. That's that one that takes, you know, 2 minutes. Part of my screening includes a 10-word recall. So that's after 10 minutes, can you recall 10 words that I named off? So that's that verbal memory. And then there's also a couple sections with choosing the word that means the same as one word, and it's multiple choice. And then there's kind of like it tests executive function, which is figuring out word, letter puzzles or number puzzles, or picking up patterns. So that's kind of my screening that I do that helps me to determine, yeah, there may be some impairment, or it's a good baseline, like what you mentioned, and it's something that can be watched over time. And there's some things that are very similar with age-related memory problems, and the reason being is that with age, our brains shrink. So the exact same thing happens. It's just with MS, it tends to be at a faster rate because there's injury to the myelin or the outer coating of neurons, so they get smaller. Yeah. Yep.
So one other comment I want to make to that actual question about aging and multiple sclerosis and the cognition is the fact is, as you were discussing, Lynsey, the screening test, it would be great if the single digit modality test was actually done in most clinics. But as you said, I think there's only one clinic that I'm aware of in the St. Louis area that does it. I'm not sure if they do it at every visit. I don't think it's a lot of a time decision. And then the other issue is when someone is thinking about their own cognitive impairment, to ask some of those questions, like how much of your daily living is it really impacting and your work life? And maybe, you know, as Shelley was alluding in terms of her question, maybe if it's forgetting a word or finding the right adjective, maybe there's a slight impairment there, but is it worth 5 hours of neuropsychological testing in only for the neuropsychologist to tell you, well, stay active, continue to do challenges to your brain. And so the bottom line is, do we really want to go through all that just to be told for, compared to another 58-year-old, you're maybe a 60-year-old. I mean, does that really make a significant impact in your life? So I think in terms of, you're right, if we would really screen, that would be helpful. But I think in reality, that doesn't always happen.
You're right. And
Any
I think,
other questions?
Oh, sorry, Michelle. I was just going to say,
Go
I think not having a whole lot of options for treating it is another reason why it's just not regularly screened in clinic. And kind of to your point, well, so what if it's aging or MS? There's still not really anything magical we can do to fix it, you know, in terms of here's a pill or here's a prescription or so.
That's right. That's right. Any other questions that someone else would like to ask?
Yeah, I was wondering, did you
Okay.
say positive attitude helps?
What?
Absolutely. Positive attitude. I think that's what you had said, correct, Margie?
Correct.
Yeah. And actually part of one of the, or part of some of the cognitive training programs that have worked includes cognitive behavior therapy, which is promotion of more positive thinking. So it could be an attitude of feeling grateful, or you're in a setting where you're laughing, you're not under stress. You know, all of those things significantly matter. And if you're the opposite, if you're depressed, anxious, stressed, that negatively impacts the cognition. So I think absolutely.
So laughing yoga helps, and there's no shower or special clothing needed. But MS Society sponsored a 6-week program on the Happiness Advantage by Sean Achor, Achor. Yeah, it's a book they gave us with the workbook. And actually, I called the library to request that they get copies, and they told me we have 10 copies of that book.
That's awesome.
What's it called?
The Happiness Advantage. He's on TED Talks too. He's pretty funny. If you need a laugh, tune into him because he is funny.
Any other questions from anybody else?
Well, I like to say too,
Well,
I was told, prepare for the worst, but expect the best. And that's kind of what I try and do, you know, prepare for the worst. Be prepared like Girl Scout.
yes.
Yeah, yeah.
Right. Jamie, you have a question. Go ahead, Jamie.
Well, one thing I noticed that before MS, I had an extensive vocabulary.
Mhm.
Afterwards, I noticed that my vocabulary had declined. So I guess about a month ago, I found this one program that sends you a new word every day and a definition. And then at the end of the week, you go back over those words.
Oh, that's great.
And that's to, help build your vocabulary back up and just keep your memory, see what you can retain. You write the words down, you write the definition. Well, I record the word, I don't write it down. And it's just something, it's another brain game. So that's something that we can always consider doing any type of brain game that will help us remember, and then where we can go back and see how much we have retained. And we can kind of gauge it that way.
Absolutely.
What is
Absolutely.
that
And
link?
that's exactly what Lynsey was talking about before. So thank you for sharing. That's very important. Any other final question? I think we were right at 8:33. Okay, Jane, you'll be our final question. Jane, you have to unmute. There you go. Oh, you were unmuted for a second, Jane. Give her one more second here. She's trying. Well, Jane, if you want to type your question in the chat box, you can do that. Oh, you want to type it in the chat box? Unfortunately, she's not able to get her microphone unmuted. So maybe she's going to type. If anybody else has a final question, please type it in the chat box now. I see somebody said exercising the brain by thinking, singing. I like that. Strengthening the muscle by singing. Play away was another great suggestion. So I think tonight we've just had a wonderful discussion. Lynsey, you've presented so much information. After tonight's call, I'm going to send you out a resource list with a lot of links that you can read further articles. There's videos you can watch. There's references for you to look up, and I encourage you to do so and continue to learn. Thank you for participating in this program that was sponsored by MS Bright Spots of Hope tonight. And thank you, Lynsey, for being our wonderful speaker.
Thank you.
Thank you.
Thank you.
Thank you,
Great
Lynsey.
night.
Thank you, Michelle.
Bye,
Okay.
Thank you, Michelle.
Bye, everybody. Stay
Okay.
healthy.
Thank you.
Bye.
Take care.
Bye. Lynsey heard of Brain HQ? Lynsey?
Brain HQ?
Yeah, they
No.